So I'll start with an obligatory opening quote. Ideas have a lot of cultural inertia, especially once embedded to the point that many people just take them for granted and incorporate them into their worldview and self-identity. Now, I'm not just sucking up to Steve. It really does encapsulate a complex topic and really sets the stage nicely for what I'm going to talk about today. There we go. See, it's all about timing, right? That would have been a little bit more impactful, but that's okay. So, babies are unreasonable. See, you stole my joke before I even got up here. Pediatrics is hard. Often we have to work with the anecdotal information, with only anecdotal information, which isn't necessarily unique in medicine. But in pediatrics, I often have to work with anecdotal information from someone who isn't my patient, a parent, some other caregiver. And I am a newborn hospitalist, so I pretty much only take care of babies, and I've always found them to be extremely frustrating. I can ask a baby a direct question and rarely get a rational response. And to be completely honest, the emotional outbursts that are frequent with babies get in the way of forging a connection and making an effective patient-doctor relationship. At least, this is something I used to say. And if I was doing this talk just a few years ago, I might have talked about the fictional baby translator from an early episode of The Simpsons, as you see here. But in 2017, I actually have a variety of baby translator options to choose from. These are real. You can get desktop versions that sit on the nightstand next to the baby. You can get smartphone applications. And they're fantastic because they can listen to the baby cry or whatever babies do. And they can tell me if the child is tired or hungry or bored or if they want a second opinion. And the one problem with baby translators is that they don't work. In fact, they're completely useless. They're like those fortune-telling crazy 8 balls that you shake to get an answer. But people have been trying to figure out what the hell babies want from us for as long as there have been babies. So we're talking 6,000 years. And you guys know me well enough to know I know that the Earth is actually 10,000 years old. So, but parents buy these because sometimes they're desperate, but in large part because it's a great idea and it's a really great story. And as we all know here, humans love a good story, parents and healthcare professionals included. I've been a pediatrician for 15 years, and I spent a significant portion of my time just sitting down, listening to people tell their stories about themselves, about their loved one, their family member. And a lot of the diagnoses I make and the treatment recommendations that I give are based just on those stories while I'm sitting down and listening. And over time, and particularly since discovering and joining the skeptical community, I've learned more and more how impactful these stories can be on medical practice, but more importantly, how terribly flawed our stories are. And I don't need to stand here in front of a group of seasoned skeptics and list cognitive biases and logical errors in logic, because you know as well as I do that the stories we tell each other, and even more importantly, the stories that we tell ourselves, are often a very poor representation of reality when it's objectively measured. And though we've made amazing strides in our ability to objectively measure things, there are stories that are sometimes thousands of years old that impair our ability to interpret these measurements, to determine cause and effect relationships, and to make medical decisions for ourselves and for our loved ones. And this can result in lost peace of mind, lost time, lost resources, and in some cases, lost lives. So medical folklore what I think of as medical folklore, are these collective and sometimes ancient stories. And they exist as part of of our cultural traditions. There's an emphasis on anecdotal evidence rather than any science-based knowledge that we've acquired. And the relationship between culture and our beliefs obviously is extremely complex and involves personal experiences, family attitudes, and group affiliations. And these come together to form a structure that shapes our understanding of our health, of illness, and how to treat or prevent it. So I thought that as a nice transition into part 2 of my talk, where I talk about my favorite example of medical folklore that still impacts care today and parenting today, I thought I would tell my own story. So, it's London. You are lucky enough to be, it's the year 1851, you're lucky enough to be one of the elites. Life is good, there's food on the table, there's coal in the furnace. You can't even remember the last time you had syphilis. In fact, you spent the day at the Great Exhibition of 1851, where you had many amazing experiences, one of which was paying a penny to use the world's very first public flushing toilets. But you return home at the end of the day still in awe of the wonders of the world and the promises of future technologies. You arrive home, you find the wet nurse and the nanny tending to your precious 7-month-old daughter. She's the first of your 3 children to have survived early infancy. They look concerned, scared even, and as you cross the parlor full of ornate furniture and fine art, you begin to imagine the worst. Your fears are confirmed when you discover that your beautiful baby girl is suffering from one of the most common causes of death, according to medical experts at the time. It's not measles. It's not diphtheria, although these are 2 extremely common causes of death in the pre-vaccine era. It's not even cholera, which was particularly rampant at the time in London. This is 3 years before John Snow's pivotal work on the epidemiology of cholera and the discovery of the role of the public water supply in the spread of that disease. But it was something just as terrifying to a parent in Victorian England. Teething. And that's right. Historically, even as recently as the early 20th century, teething was considered to be one of the most common causes of severe illness and even death. Anyone ever heard that before? Great. That's why you're here. So the reaction of a parent to a teething child in 2017 obviously would be a lot less dramatic. Although in some parts of the world, there are still beliefs that teething can cause death. But even in developed parts of the world, it's a common cause of parental anxiety, a common reason for parents to seek help from the medical system, from family members, from friends, or from our favorite, the internet. And though death would be unlikely, it would be unlikely for death to be included on a list of parental concerns in, say, the United States. There's a long list, as you can see, of things that are currently attributed to the simple act of a baby tooth entering the oral cavity. So before I get into the really interesting part of this talk, the history of teething and why people used to blame it for death and other serious illnesses, I'll quickly run through our current scientific understanding. Most of you here today know what teething is, right? It's the process by which the baby teeth, the 20 primary or baby teeth, come into the mouth where they can be used. But it's actually the very final step of a long journey that began in the 6th week of gestation when tooth formation began. And with roughly 1 tooth coming every month, it generally takes until about 30 months of age, and definitely by 3 years, for all the teeth to come in. And so this is a chart showing the classic symmetrical bilateral process where the teeth come in, starting with your lower teeth in the front, the incisors, around 6 to 10 months of age, then your upper teeth, and it follows a lateral pattern with going in a line. The bottoms will come in, then the top, or vice versa. So there's definitely some variation. But by, again, 30 months, give or take, definitely 3 years, those second molars in the back will have come in, and the teething is done. And how the tooth, or why the teeth start moving, how they move, is actually not known. It's likely a complex combination of processes kind of beyond the scope of this talk. But what we do know is that as the tooth comes close to the gum line, there's a growth of new blood vessels, so you may see some redness. It's typically mild. The connective tissue between the tooth and the gum actually begins to degenerate and then remodel itself. So the gum actually moves out of the way of the tooth. There's no cutting involved, even though that's an old-fashioned description of teething, cutting of teeth. And then there's often a mild infiltration of inflammatory cells just as a tooth is about to emerge. But swelling is actually uncommon, and when it does happen, it's typically mild. Now, of course, there are exceptions sometimes, but they're rare. This is a description of teething for the vast majority of infants and young toddlers. And so when dental experts who are trained at noticing the first hint of a tooth approaching the gums, when they investigated, they found that it takes about a month per tooth for the whole process. But what is considered symptomatic teething is the eight-day period surrounding the first time a parent happens to notice a tooth breaking through the gum. So 4 days before that point until 3 days after. And again, this is really only just based on anecdotal observations. But there are parents, and this is actually fairly common, who will believe that their children are teething for weeks on end, even months, without a tooth appearing, which doesn't make sense if teething causes symptoms, but it actually makes pretty good sense if the actual arrival of the tooth doesn't really have anything to do with these symptoms. This is a very common teething timeline. If parents go online and Google teething, they'll find many variations of this, but they pretty much stick to that 8-day period. You can see how on day 5, that's when symptoms are supposed to be the worst, because that's just the day the parents happen to notice the tooth. And you can see some cute drawings and some descriptions of symptoms the child might have. Why teething would cause a diaper rash is completely beyond me. But this helps build the expectations of what's going to happen around the time a tooth arrives for parents. So what is the reality of teething? Well, the reality is that the process of teething actually is very unlikely to result in any symptoms at all, with perhaps the exception of some very mild soreness of the gums as the tooth emerges. But parents are primed to expect these things because of the stories that are told and because of the things they find online. When parents describe the symptoms, they're nonspecific, they're vague, they're common throughout infancy, often just part of normal development. At a certain point, not coincidentally around the time teething begins, kids are exploring their environment with their mouth, and they put everything in their mouths. And so that can be perceived as the child is uncomfortable and thus wants to chew on something. So, and also children randomly will fuss or have a few nights where they're not sleeping well or have a low-grade temperature that in reality is actually a normal temperature. And sometimes they have minor self-limited viral illnesses. And if you can imagine, there's a new tooth coming in every single month. It's really easy to make these false connections between whatever random behavior changes or symptoms the child is having and the presence of a tooth coming in. And unfortunately, healthcare providers often perpetuate these beliefs, these myths, because when a child comes in with random symptoms or fluctuations in behavior, it's really easy to say, oh, it's probably just teething. And thinking that it might help a parent feel better to have something to blame rather than perhaps having a more difficult conversation in that short window of time for your well-child visit. So when studied, no constellation of symptoms has been shown to predict the arrival of a tooth. And these concerns, these symptoms that parents often complain of, don't seem to be connected with the teething process at all. But when parents expect that their child is going to have certain symptoms, they will often see those symptoms, kind of a self-fulfilling prophecy. And then if you add in the potential for recall bias, where weeks, months, years later, because of the influence of our culture and the internet, parents are perhaps more likely to remember that their child was more symptomatic than they really were. And then there's the confirmation bias, where we forget all the times where a child had a tooth come in and they were perfectly fine, but we remember the times that they may have been symptomatic in some way. So false beliefs about teething go back at least to the days of Hippocrates, further, almost certainly. And they're an excellent example of medical folklore influencing modern thinking. And these beliefs still are placing children at risk of both direct and indirect harm, as I'll get to. And this can come from concerned caregivers, well-meaning conventional medical providers, proponents of alternative medicine, and then companies looking for fear-based profits. So this is Hippocrates, and he said, teething children suffer from itching of the gums, fever, convulsions, diarrhea, especially when they cut their eye teeth. And if you're not familiar, eye teeth are the canines, they're the third tooth on either side, the big sharp ones. And so Hippocrates believed that a variety of minor symptoms could occur with teething, but convulsions, seizures, these concerns of more serious outcomes certainly didn't start with the great philosopher. This belief that infants are somehow more at risk, more vulnerable to stress and illness go back well before the father of Western medicine, and they haven't eased up. There's plenty of it around. It has evolved somewhat, especially since the invention of childhood vaccines. But it's still often capitalized on by quacks and charlatans, and it does still often lead to unnecessary medical interventions when going to an ER, an urgent care, or the doctor's office. Another example of this is the pervasive and sometimes irrational fear of fever in young children, despite the fact that because of childhood vaccines, the likelihood of a fever in a young child representing a life-threatening illness is extremely low. But parents and sometimes medical providers will often panic in the face of a high fever. So this is John Arbuthnot. He was at one time the royal physician to Queen Anne. And in 1732, he stated that 10% of children die from teething. And he wasn't alone. There were plenty of other experts that weighed in. There was even a late 19th century dentist who upped the ante, believing it was a full third of children would die before their 20 baby teeth arrived. This is a death certificate from 1890, and I know it's kind of fine print, but this is a 15-month-old little girl whose primary cause of death was listed as teething. The secondary cause of death, listed as a possible contributing factor, was meningitis, which actually makes sense if you consider the thinking of the time. This connection between teething and serious outcomes likely had numerous pre-scientific explanations, whether it was evil spirits or humoral imbalances. But as our understanding of human physiology improved, increasingly it was blamed on derangements of the nervous system, quote unquote, the nervous system. And it was believed that a weakened nervous system would result in a child that was unable to resist or recover from a variety of afflictions. So, for instance, that's why meningitis was a secondary cause, because if the child hadn't been teething at the time, he may have not gotten the meningitis or may have resisted or recovered from it. And this belief persisted until, again, the early 20th century. There were even parenting books in the 30s talking about how deadly teething could be. This is the same fear behind the belief that masturbation causes blindness. You probably didn't think I was going to go there, huh? And this led to popularity of circumcision in the United States. Of course, this is a whole other lecture that I have. But the reason circumcision is popular in the United States is because at one time it was believed that masturbation caused nervous system weakness and of seizures, blindness, a variety of ailments. And early circumcision was recommended to prevent teenagers from masturbating. It didn't work. And these same fears are actually still prevalent today, not so much about masturbating, although you still hear teenage boys spreading these myths. But there are chiropractors who claim to be able to treat a variety of general health problems by improving the function of the nervous system. And last year at NECSS, I spoke about this. There are even chiropractors who claim to be able to prevent death in infants by improving the nervous system and preventing SIDS, or shaken baby syndrome. So it's still out there and being taken advantage of. But as you know, masturbation won't make anyone go blind, and chiropractic subluxations do not cause SIDS, and teething doesn't kill babies, at least not directly. But many children, historically, in the first 3 years of life, would die from what we now know as vaccine-preventable illnesses or a variety of other ailments. And with roughly a new tooth emerging each month, again, it's really easy to understand how those false connections were made between the presence of a new tooth and whatever happened to kill that baby. And the increasingly powerful cultural inertia behind these beliefs that teething is deadly, and then the absence of a systematic way of observing and testing, which we know is science, it makes even more sense. So this is, I could only find an illustration. I couldn't find any pictures of this actually being done, which I guess is a good thing. But this is an illustration of a young child having their gums lanced or sliced open with a sharp instrument. And this was done to treat teething. So in 1575, French surgeon Ambrose Paré popularized this procedure, and it took off in most of the world, the United States, Europe, England, and again, it became common practice. Slicing into the gum of a child before we had an understanding of the importance of sterilization or the invention of antibiotics in case infection set in was undoubtedly a death sentence for many of these children. Historically, there were many other remedies that were used for teething. Remember, all with the goal of keeping the child from dying or having some other serious ailment. There was bloodletting, although when I looked into it, they wouldn't bleed kids under a year, which I thought was really nice of them. One of my favorites, topically applied rabbit brain. Opium syrups, leeches, fresh air, which I'm okay with, purgatives. So based on the humoral system of medicine, for hundreds of years, what we would do is give people, for instance, mercury-based compounds, like calomel was a popular one, to make people vomit and have diarrhea and either get rid of built-up toxins or balance their humors. And it killed a lot of people, and it undoubtedly killed a lot of babies. Honey seems benign, and it would be in a child over the age of 1, but in infants, because of the bacterial spores that can be present in honey, it can cause infant botulism, which, again, deadly. There were no antibiotics. There were no ventilators in the 19th century. This is this is an ad of a popular teething remedy called Mrs. Winslow's Soothing Syrup. This was sold until 1930, and it's sweetened morphine. So lancing of the gums went out of favor in most of the world, but there are still pockets, particularly areas that don't have access to modern medical care, where these beliefs persist and these procedures persist. In researching for this talk, I learned about a completely new issue called false teeth disease. And this came about in Sudanese villages 30 or 40 years ago and spread to Uganda and some other sub-Saharan countries, and then to countries where people immigrated to. So this has been seen in Australia, for instance. And it's the belief that a false tooth, like a maggot or a piece of infected corn, is in the gum, or it could have been placed there by a bewitchment or some supernatural force. And the village healer will take an undoubtedly dirty but sharp metal instrument and dig it out. And what it is the baby tooth. And these people are desperate, again, because they don't have access to medical care. They have children that are sick for a variety of reasons, and so they're just doing whatever they think is best for their child. But undoubtedly, there are babies who are suffering severe pain, severe injury, and death from infection. And the one study, the most recent study I found of this showed that more than half of Ugandan children undergo that. So infants in other countries are unlikely to, for instance, the United States. They're not going to be having their gums lanced or their teeth dug out. But there are still plenty of potentially risky modern-day remedies. This child is wearing an amber teething bracelet. These are very popular. And the thinking is that it imparts a healing energy into the baby. So people who really want to dress it up with a little bit of science, certain chemicals, pain-reducing chemicals, leach into the baby's skin. And obviously it doesn't work beyond parental placebo, and it's a significant strangulation risk. And if this were to break, a baby could choke on the individual beads. But I appreciate how, for good measure, he's also, or she, not sure, is also wearing a healing crystal. Can you see that? It's probably rose quartz or something like that. I guess it's never bad to have a backup plan. I really got a kick out of this. This is from mommypotamus.com. And they raise the very important question of, is your child's amber teething necklace a fake? Implying that only amber works, but some other substance would not. And to my knowledge, there haven't been any head-to-head trials, but I think it's probably safe to assume that it doesn't matter. So Britt talked about this earlier during her talk. Homeopathic remedies are extremely popular for teething, and in particular, Hyland's teething tablet is one of the big ones. Been around for decades. And there have been very serious health concerns raised by the Food and Drug Administration, in particular with Hyland's. And the concern is adulteration with belladonna, which Britt mentioned. So in both 2010 and 2016, the FDA warned about inconsistent levels of belladonna in these products. And so if you're familiar with homeopathic remedies, then you know that sometimes they are unusual active ingredients, toxic plants like belladonna, snake venom, moonlight. And belladonna, it doesn't take a lot to harm a young infant, and it can cause seizures, coma, death. And the FDA investigated 300 reports of adverse events related to this product with 10 deaths. And despite 6 or more years of asking for Hyland's to recall these products, Hyland's continued to refuse until just really recently, just in the past few months, because of it finally got in the news and there was negative press. And so Hyland's pulled the products. For a while, they had just pulled them in the U.S., but you could still get them in like other countries or ordered online. But now it's been officially recalled. But they still maintain that their product is 100% safe. There are, again, plenty of other modern-day remedies, all of which are going to be ineffective, some of which are going to be dangerous. Essential oils, when topically applied, can cause very severe reactions. And so when you look into this, they'll always recommend diluting it significantly before applying to a baby's gum. You should probably tell them something. Other topical herbal remedies, a variety of other homeopathic remedies that don't necessarily contain belladonna. They may be safer, but they're not going to do anything. Choking foods are very common. I mean, they don't recommend choking foods, but the foods they recommend are choking. One example that's come up time and time again are frozen bagels. Allow a 9-month-old to just gnaw on a frozen bagel. Well, it's going to thaw out, and then it can break apart and become a chokeable. But not all of these are from the world of alternative medicine. For instance, Tylenol and ibuprofen are very frequently recommended by medical professionals for teething infants or for infants who are perceived to be teething. And although they're pretty safe medications, both have the potential for risk, even sometimes serious harm, and there's really no benefit from these medications. So, of course, if there's no benefit, then the risk, any even small risk, will outweigh that benefit. More concerning are these topical numbing gels with benzocaine. Most pediatricians and family docs will recommend not to use these, but they're still out there. Benzocaine is a topical anesthetic, and if applied to a mucous membrane of a young child and it gets into the system, can cause a severe, life-threatening reaction. So what do you do for teething? Well, remember that most of what is perceived as teething is likely just random behavior changes, or they may have a mild self-limited illness, or it may just be normal part of their development. Again, kids like to chew on things. So you don't want to do anything that's potentially risky. But it is theoretically possible that a child may have some numbness in the gum. And so TLC is always, I think, a first-line option for any child that may be uncomfortable. But something safe and cold to chew on is not wrong. And there's plenty of products available for parents. But if a child has true fever, if they have significant irritability, inconsolability, diarrhea, vomiting, significant swelling or redness of the gums, anything like that, they really should be evaluated by a non-naturopathic primary care provider. So just a few final thoughts. The history of teething is a perfect example of the absurdity that a pre-scientific attempt to figure out the world leads to. Right up there with humors and homeopathy. And because of the cultural inertia that is built up over, again, thousands of years, medical folklore continues today to be passed down from generation to generation, and even at times endorsed by conventional medical providers, despite our improved scientific understanding. And although these stories do sometimes evolve over time and become less scary for parents, again, most parents don't think that teething will kill their child, it still can result in children being exposed to risky treatments without any benefit. Parents who believe these myths aren't stupid. Far from it, right? Like all humans, including every single person in this room, they're hardwired to be just a little too good at finding patterns. And what they've done is found a false signal in the noise inherent in taking care of a young child. We're all vulnerable to this, even when we aren't sleep deprived, are facing a constant barrage of misinformation. Stories will always be a fundamentally more powerful means of changing behavior than dry medical facts. So we just have to come up with better stories. And if we don't, I have to worry about what beliefs will become entrenched in our culture 100, 1,000 years from now. But one thing I'm definitely looking forward to, baby translators. Thank you.